Hi, I'm Doug Seven, Senior Director at Microsoft Health Next, and welcome back to our video series on the Azure API for FHIR. In the last video, we looked at the role of FHIR in modern health systems. In this video, I want to talk about the role of United States legislation in advancing the use of FHIR across health IT. In this case, we're going to be talking about the impact of what is known as the ONC Final Rule as part of the Cures Act. As mentioned before, we've seen the growth in the digitization of health IT, which has been tremendous for the ability to access information in a digital form. This is great at the point of care within a single health network, but it's been a real struggle for organizations when they're thinking about how to get data from other systems, how to exchange data between different provider networks. Anybody who's moved or switched providers in the United States has probably experienced this situation. If you move across the country, you need to switch your healthcare providers to new providers where you live. And oftentimes it can be challenging to get data from your previous healthcare providers transferred over to your new healthcare providers. In some cases, you might just be working with different providers in different healthcare networks in your same city, and it can often be difficult for them to exchange information. The systems aren't designed for this kind of interoperability, and so the state of the art often is sending a paper request to one provider to have them fax information to another provider. This can be very challenging as well as detrimental to the care of patients. The ONC Cures Act Final Rule is designed to give patients and their healthcare providers secure access to health information. It aims to increase innovation and competition by fostering an ecosystem of new applications to provide patients with more choice in their healthcare. This final rule includes a provision that requires that all patients can electronically access all of their healthcare information, whether it's structured or unstructured data, and this will be at no cost using an application of their choice. This is really critical because what the final rule then defines is that all electronic health information needs to be programmatically accessible to both healthcare providers for the purposes of care and to patients for the purposes of access to their own data. The final rule has impact on a number of different constituents in the role of healthcare. If we start by thinking about patients, the final rule says that patients get ease of access to their data. They get to access that data programmatically through applications of their choice. This is tremendously important as a patient having a right to have access to my data and to be able to get that data programmatically using a variety of applications will create a rich ecosystem of new applications from new vendors available to me. From a provider or clinician standpoint, this means that I need to make data requests easy and inexpensive because I have to make this data freely available to patients. I have to do this in such a way that I support a choice of applications. So it can't just be through a proprietary application, but I have to expose this data in a way that makes it available to many applications. And I have to do this in a compliant and secure way. For health plans or health payers, there's also rules being adopted by the Centers for Medicare and Medicaid Services in support of their incentive programs. So health plans also need to implement patient access APIs and provider directory APIs to programmatically provide access to that data as well. All of this is hugely important as it means that this legislation of the final rule is promoting the use of digital healthcare data across an ecosystem. Now, the interesting part of the rule here is that the rule had to make a decision on what the standards were for the exchange of this data so that all of these systems could work together. So the final rule specifies FHIR R4 as the implementation specification. In other words, patient access APIs, data APIs, different app ecosystems will all be supported through FHIR APIs. The ONC has published a timeline for the implementation of the final rule and the implementation of the FHIR-based APIs that will support the final rule. The effective date of the timeline is June 30th. In other words, that's when the timeline really begins. And then there's key dates throughout 2021, 2022, and some final dates in 2023 for the implementation of these systems. This is really important because it means that healthcare providers and healthcare payers are on the clock in terms of getting their support for the ONC final rule in place and support with FHIR APIs. Some of the key deadlines begin as early as April 5th, 2021, and by the end of 2021, we should see most healthcare providers and payers having these APIs in place. By the end of 2022, it's mandated that all HL7 FHIR APIs be available and rolled out. In this module, we looked at the impact of the ONC Cures Act final rule on the implementation of FHIR across the health ecosystem. This is really important because this rule essentially makes FHIR the de facto standard for the exchange of health information across systems in the US healthcare system. It's likely that other healthcare systems around the world will follow and implement the standard so that data can be exchanged worldwide using the same set of standards. In the next video, we'll introduce the Azure API for FHIR. This is the application of the FHIR specification in the Microsoft Azure cloud. Thank you. We'll see you in the next video.